The World Health Organization has said that the world has never been in a better position to end the COVID pandemic. Citing the drop in number of newly reported COVID cases, the WHO chief said that the world must seize this opportunity. The UN agency chief further added that though we are not there yet, the end is in sight now. However, the agency cautioned that the failing number of reported cases is deceptive since many countries have cut back on testing and may not be detecting the less serious cases. So, important statement coming there from the WHO chief. Joining us to discuss this afternoon is Dr. Ishwar Gilada, an infectious diseases expert, and Dr. Narinder Mehra, former Dean of AIIMS in Delhi. Thank you very much, doctors, for speaking with Mirror Now this afternoon. Dr. Gilada, to you first. WHO chief said that we have never been in a better position to end the pandemic. We are not there yet, but the end is in sight. What would the end of COVID mean?
This is, in fact, a very good news, and thanks for having me here on this show. WHO chief is right, and probably he's delayed in saying that, probably because he's a chief of the health organization of the entire world, and he has to comment based on problems elsewhere. I have been telling for last 6-7 months that Omicron has been a variant of support rather than variant of concern. Ever since Omicron has come, though infections are there, but the infections are not leading to morbidity and mortality. People are not getting to bed, they are not requiring oxygen, they are not getting into ICU or ventilator, and death rate is very, very low. Death rate is so low that it is as good as any other viral fever or flu. In fact, sometimes more people are dying of flu than COVID. So under this situation, we know that this is end in sight. We know that we are heading towards endemicity, and none of the pandemic in entire 100 years of history has gone beyond 2.5 to 3 years. So 2 years, 2.5 years, 3 years is quite a long time. So I think we can rejoice. However, he is right in saying that we should not sit idle. We should keep on testing. But even if you do less testing, it doesn't mean that people are dying and they are not tested. So people who are dying, who are sick, who are clinical, so there's a targeted testing is always there. But a lot of people having some symptom, they are not going to doctors, they are not going to labs, they are not testing because they know that nothing is going to happen. And we also don't force them to get tested, even if in a family of 4 or 5 people, they have symptom. If one is tested positive, we say all are positive. Consider all of you are positive. Quarantine yourself for 3 to 4 days. No need even for 7 days now, and keep quiet. So I think that is the way we should look at COVID currently.
All right. Dr. Mehra, Dr. Tedros said that we have to seize the opportunity now. So what can nations do? Because he goes on to say that otherwise we run the risk of more variants, more deaths, more disruption, and more uncertainty. So what can nations do to when he says that seize this opportunity now?
Thank you very much for having me here. I fully agree with what the WHO chief has said and what Ishwar is saying now. I think the short history of COVID-19, 2.5 years, 2021 was the year when we saw a lot of variants. We saw the alpha, beta, gamma, delta, and then the later part of 2021 came the Omicron. Omicron has come to stay now. It is like Omicron's lasting dominance. Although we have seen certain strains of this from BA2, BA2.12, 0.4, 0.5, it might go on like this. But I think we are definitely is going to be seeing the beginning of the end of the pandemic now. And I fully agree with Dr. Gilada that in the past, the pandemics have never gone beyond 2.5 to maybe maximum 3 years. And I think it's time that we, and also because of the fact that we now are in a much better situation. Look at the fact that there are about more than 100 nasal or oral vaccines on the trial. One of the vaccines has already been tried in China, and we also have our own, the Bharat Biotech. The nasal vaccines are really going to be very good. They're going to be game changer because the COVID-19 vaccines currently in use do a very good job of reducing the disease severity and preventing hospitalization. But they don't block the transmission. They don't block the mild illness. Nasal vaccines probably could do because the mucosal vaccines lead to a whole body immune response there. We do create cells, the memory cells, these are called the resident memory cells. They remain in the respiratory tract and therefore they act as what we call sentinels at the site of the infection. So I think these are all very good things. And also because of the fact that the new antivirals are also being developed, we are in a much better situation. And that's what makes the WHO chief say that we are nearing the end. But again, a word of caution. The word of caution, there is a group of scientists around the world who also believe that a new variant might still be developing in a chronically infected individual. And we might have to search for a new Greek word, maybe pi and all that. But I think these are all speculations at this point of time. Most countries on the world have actually abandoned the mask as well. But somewhere we have to be careful as well.
Yes. Dr. Gilada, Dr. Tedros also urged the nations to vaccinate 100% of their high-risk groups and keep testing for the virus. So vaccination and testing is key, isn't it? So I want to understand from you, the vaccine inequity in the world, is that still a big problem globally?
There are two things. One is, yes, vaccine is important. Even possibly annual doses may be important. Vaccine inequity was there, but India had come to the rescue of the entire world. It's not rich countries, it is not powerful countries which saved the world. It is India that saved the world. So we salute the scientists from India. We salute the pharma companies from India. They have been able to provide, whether it is a pharma or vaccine, at pittance of the cost. Secondly, it is not merely important of vaccination. If you see currently, whatever number of cases you are getting globally, three nations are driving half of the cases: Japan, South Korea, and Taiwan. And possibly China, but China is hiding. No one knows reality about China. And why? Because wherever there was the strictest lockdown initially, they are now suffering from cases. Secondly, wherever there has been Chinese vaccine use, Sinovac use, they are suffering. Now, I remember my grandmother used to say during the measles days, if one child in the community is to get measles, they used to have a measles chamber. They used to bring other children in the room and put all the children there so that they get measles now in childhood and they do not get in the adulthood. So that is not serious problem. Same thing with Omicron. If everybody got infected, natural infection plays a greater role than vaccine. Yes, vaccine is important, but hybrid immunity or natural immunity also plays a role. So those who got infected, they may be reinfected with the newer variants or sub-variants or sub-variant, but they are not severe. So barring Delta, whether alpha, beta, gamma, epsilon, they have not created much problem. Omicron is much softer than all other variants. So I think we should be very happy what is currently happening. We should continue to vaccinate those which are at more risk and vulnerable. If and when the vaccine comes for below 5 children, we should vaccinate them, because whatever tool we have in our hand, whether it's a vaccine or mask, they have to be appropriately used.
Yes, Dr. Mehra, let's also talk about India's strategy. How should India strategize? What steps should India take? Because as the WHO chief said, a marathon runner does not stop when the finish line comes into view. Now is the worst time to stop running. That's what he said.
Yes, of course. And I think the first and the foremost thing is that we want to make sure that everybody takes the third dose as well. At the moment, the number of people who have taken third dose in India is dismally low. I think we have to encourage people. And that's where the role of channels like you will come. Please keep on spreading the message to the common man. 2 doses are as good. They may not be sufficient. Please go for the third dose. And you remember there are countries like Israel which have also given the 4th dose. And at the moment, the CDC in Atlanta has only recommended the 4th dose for those people who are either aged, more than 60 years of age, or those with the immunocompromised situation there. The other thing is, I think India would need to really upscale its infrastructure as well. And that's what we are doing. At the moment, as you can see, and I was looking at the data, that the number of hospital beds in India at the moment is 1 per 1,000. We need to increase it to 2 per 1,000. We need to also increase the number of doctors, the number of colleges and all that. And of course, we have done very well so far. In the last few years, 18 new aims have been established, more than 150 new medical colleges have been established and all that. But on the research front, I think there is a light at the end of the tunnel. And I was looking at the budget of the ICMR, and there is already a plan to create a National Institute of One Health. I think One Health is going to be very, very important, because there you not only look at the human host, the animal, and the environment as well. So there is a need for a National Institute of One Health. I must say that India is also a part of the G20. India is going to take over the presidency of G20. I'm actually coordinating the Science 20 component of G20. And there we will propose creation of a network of National Institutes of Health in these G20 nations over there. I also know that the ICMR has planned to create 4 regional virology institutes, and there are strengthening of the VRDDL labs. So I think a lot is being done. We need to really increase our infrastructure, and India is in a much better situation right now. All these plans are underway, and I'm sure you will see in the next 6 months or so, they will see the light of the day.
All right, Dr. Gilada, one final question to you. After we cross the finish line, will we need a COVID vaccine every year, or how often would we need to take that jab?
See, Rohit, there are 2 possibilities. One is there could be annual vaccine, particularly for those which are above 60 with severe comorbidities, not comorbid. Comorbidities everybody has. Everybody has a hypertension or something. Secondly, it may be a vaccine which will be part of flu vaccine. So it can be a flu plus COVID vaccine together. And I think that will be a wiser idea, because flu is becoming a much more prominent now, particularly H1N1. And a lot of people are sick with the flu more than the COVID currently. So I think we should look at those possibilities. No doubt India will be able to provide vaccine at much cheaper rate as compared to the world. And India will not only meet need of India, but it will meet almost 80 to 90% of global supply. So I think we are in a much better position, as Dr. Mehra said.
Right. All right, Dr. Ishwar Gilada and Dr. Narendra Mehra, thanks very much for speaking to us, sharing your perspective on this story. WHO chief is saying finally there is end to COVID in sight. We are not there yet, but we can see the finish line now. Thanks very much, doctors, for joining us this afternoon.